Hey, what's up you guys? Hey, thanks for watching this video. I have an interesting topic just to discuss today, and this is pertinent to definitely medical students and residents, and all doctors really, but if you haven't really heard about this topic, which is called malingering and conversion disorder, then maybe, you'll start kind of looking for it in your, medical studies and on your patients and stuff. So malingering, number one, is basically kind of like faking a disease for secondary gain. So typically, somebody comes in and they say, well, I have a headache and I need oxycodone, a narcotic. And so they come into the ER or something like that. Or I hit my head when they didn't really hit their head. And, all the CAT scans and physical exams or normal, typically really back pain. This is classic. Back pain, I threw out my back and everything's normal. Get a CAT scan, get an MRI, $20,000 workup in the ER or the regular doctor, family medicine doctor, and then, I still have this pain and I need some pain meds, doc, and as a physician you think, well, I could be wrong, I don't find anything, but certainly it could be like some muscular pain that doesn't show up on a CAT scan or MRI or, physical exam type of thing. So, okay, well, let me just give him a little pain medication to tide him over, but, hopefully that'll go away and they'll be good after, a short period of maybe inflammation from muscle or something. So, as a doctor, you don't want to not treat this person who's telling you pain. You want to believe all your patients, although you shouldn't, because people lie to doctors all the time. But that's a whole other story. So you give them the pain medication. So that is typical malingering. You come in, you lie about your symptoms for a specific secondary gain. So for example, I've had actually prisoners do this quite often, and I personally had patients that are prisoners that will stab themselves or shank themselves or place some utensils, as in a fork or a knife or a spoon, into their abdomen. And obviously you can't put a spoon into your abdomen just with no incision, but some guys will try and find something sharp and put that into their abdomen because they know they're going to be taken out of the prison, which is a secondary gain, put in a hospital, right? There's going to be a nurse taking care of them 24/7. They're going to get 3 meals a day, right? They're not going to have to do all the shit in jail that they have to do or put up with. They're going to have their own room. They're going to have TV. It's like a vacation for them. So on top of that, then they get narcotics after the surgery that they get because they know, because other guys have done it too. So this kind of perpetuates. These guys tell each other, you do this and then you'll get all this stuff, plus you get pain meds and drugs. So that is a good example of malingering, or a bad example. I don't know which one you got. I had one guy do it 6 times. So at some point, he injures his bowels, he has a frozen abdomen, we can't really go back in, we just basically put drains in, make him NPO, TPN, and the guy loses 40 pounds and stuff. It's a disaster. And, so if you keep doing that, then you'll die, but they don't know that. So yeah, it's a bad deal. And it doesn't have to be drugs, it could be just attention. A lot of people just want attention, they're at home, they're maybe an elderly person and they don't have anybody talking to them and stuff, and so maybe they'll go to the doctor and say, well, my elbow here hurts right here, I see this little bruise right here that's 2 millimeters, I got that bruise there, things like that. So that's malingering. And then the other one is, so this is conscious, this is a conscious decision to make. And the other one is conversion disorder, and that is a subconscious faking, sort of, but really, the person feels that they have a disorder, whether it's a headache for a certain reason, whether it is back pain, whether it is arm pain. They can't feel their arm. They'll say I got in this accident and I can't feel my entire arm. Well, which part of your arm? Is it the lateral or the medial? Is it which fingers? It's everything. It's just from the elbow all the way down, and you're well, that doesn't make any neurologic sense, because this is the reason you go to medical school. You learn all these, the nerves and the dermatomes and all that stuff, and figure out where if you injure a nerve, where the problem should be. And these people don't follow any of these neurologic rules, basically. So I just kind of wanted to mention those two things to you guys. You'll learn about this in psychiatry if you haven't taken that class already, but it's definitely something to keep your ears and eyes open for, because it happens more than you would think. And sometimes, unfortunately, our job as either medicine doctors or surgeons are to determine whether patients are having real pain or not. And it's crazy, because with the conversion, they're actually having, they're experiencing pain, but it's not organic, as in it doesn't have a physical, it doesn't have a physical reason. Something is not broken, but their psyche is developing this pain, and so that's a real problem, because if you approach somebody and say, "Oh, it's all in your head," they go bananas. But they do have the pain. You have to remember that, even though sometimes it's a little bit, you get a little angry at people because you're like, "Oh, you're taking up resources and you're just here for fake reasons," but they're really not fake. They're really experiencing this pain. They just don't know why. And it could be a lot of different things. It could be stress, that they develop pain with stress. I actually developed chest pain with stress, but I've been having it since I was 14 years old, so I'm not really that excited about it every time I have chest pain. When I have really stressful situations, I get chest pain. One of my good friends in residency, she got headaches all the time, but it was just because we were having a lot of stress. It wasn't anything organic, and we would we weren't going and asking for narcotics because we had chest pain and headaches all the time, but we definitely developed real pain. So it's a difficult thing to deal with in medicine in general, to figure out what to do with these people. And sometimes they just need somebody to listen to them, and someone to say, "Hey, I understand your problems, and this sucks, and you're right, and hopefully it'll get better, and maybe you can try these things, and to de-stress or whatever." And sometimes just listening to the patient and not talking at all is the only thing that they need. So I hope you got some value out of that little video there. It's a little short, but go check it out if you haven't heard of those things before. Malingering and conversion, very interesting stuff. That's why I like medicine. It's crazy shit. People are nuts. I mean, not in the sense psychotic, but it's just bodies are crazy, minds are crazy. It's fascinating. The fascinating crazy. You know what I'm saying? I hope you know what I'm saying. Anyway, hey, subscribe to my channel if you can, and maybe like the video, share it with a friend. That'd be awesome. Talk to you later.